Hey everyone, welcome. My name is Dr. Scott Gray, and I'm super excited today to have a guest on with us. That he's going to talk a little bit about who he is here in just a second. But I started working with Dr. Ashim probably a few months ago, and really it came from us working in regenerative medicine and different things. And he's adding a lot of cool things to his practice and doing things that I'd never even heard of before. So. Uh, Doc, thanks for jumping on today. I wanted to learn a little bit more about what you're doing and hear how you're using it in your practice. So, why don't you start off by telling us a little bit about your history and your background and what's led you up to today and where we are?
Yeah, first and foremost, thanks, Dr. Great, for having me on. Really, really excited to be here. And like you said, we both love regenerative medicine. I'm excited to talk about that today. But yeah, my name is Dr. Ashim Wadehra. I'm actually a podiatrist, so I work with the foot and ankle, knee below. I'm fellowship trained, double board certified. I was kind of the traditional foot and ankle surgeon, if you will. My training background was very traditional surgery, prescribing medications, seeing a lot of patients, going through sort of that traditional, a lot of patients, a lot of volume, and just being prescribed medications like every other doctor would. And, really the only thing I knew was surgery, and then let's prescribe some medication, hope they get better. And things obviously have evolved over the last several years, but that's kind of what, my background, if you will.
Yeah, I love it. So, what are a lot of the main conditions as a podiatrist? What are a lot of the things that you see in your office and that you're using this for?
Yeah, that's a great question. So, I'm still a surgical podiatrist. I still do surgery, but I've really niched down. One thing that we do and what I specialize in, aside from regenerative medicine, which we'll obviously talk about here shortly, is minimally invasive surgery. So, what I've done is learned a technique where all of my surgery, if it's needed, is all done through a very, very little incision. It's almost 3 millimeters. But when I talk to patients, the easiest way to comprehend this is if you look at the tip of a pen. The tip of the pen is literally the size of the incision that we use to fix our bunions, our hammer toes, and so forth. But we've really shifted our approach now, and I really love something known as Regen Med. And what we really work on for our regenerative medicine patients is, patients that are coming with, let's say nerve pain, also known as neuropathy or diabetic neuropathy, heel pain, also known as plantar fasciitis. A lot of people deal with this. Achilles tendonitis. Flat-footed patients, patients that have maybe had surgery elsewhere that are now having complications and so forth. We have a lot of amazing non-surgical modalities, and this is a surgeon telling you, there's a lot of great non-surgical modalities that can really help our patients really feel awesome. I always tell patients, coming from a surgeon, surgery is not always the answer. Surgery can be done, but it's not perfect. Even in the best surgeon's hands, you just never know how that patient's going to turn out. So I always tell my patients, it's like a tattoo. Make sure you really want that surgery before you get it because it's going to be on you forever. Why not try all the non-surgical things that we have? And we have a plethora of beautiful modalities now that we're going to talk about here that I'm very passionate about, that I've helped a lot of my own patients with and myself, that we have now at our arsenal.
Yeah, I love it. So tell me a little bit about that. I know that you've got this pretty cool laser that you use in your
Mhm.
practice.
Mhm.
Tell me a little bit about that, what you use it for, and maybe what you would have done in the past versus what you do now with the laser.
Yeah, let's use heel pain for example. Plantar fasciitis. So we use a class 4 laser. It's known as MLS or multi-wave laser. And what I love about the laser is that it's completely non-invasive. There's no downtime involved. And what we are doing with the laser is we are literally healing the patient from within. So we're not pumping them full of any harmful drugs. We're not making any incisions on the body. We're literally healing the patients through, a very fancy term known as photomodulation. What the heck does that even mean? Really, what that means is we're literally stimulating the cells within, we're flushing out all the bad cells, and we're bringing really, really healthy blood to the area. And in our blood, as you know, it's we have like an internal pharmacy, as we say, right? The blood has all the nutrients that we need to heal ourselves. The body is really, really smart. Unfortunately, when we get caught up in sort of an inflammatory cascade or we're hurt or we have something broken, things kind of sit idle, right? Those inflammation cells, those inflammatory cells, whatever you want to call them, kind of sit. And, the body is really good at flushing this stuff out, but unfortunately, we kind of get in this chronic mode. And so we need to reset. So it's almost like a computer, right? Something's going on wrong with the computer. What do? Control Alt Delete or hit the reset button. That's kind of what the laser is going to do. We're going to use laser on the patient, flush out all those bad cells, really create something known as angiogenesis, which is again another fancy term for regenerating blood cells and blood vessels, bring healthy blood to the area, flush out all the bad cells. So let's use heel pain, for example. Heel pain, known as plantar fasciitis. We have a ligament on the bottom of the foot. It's like the floor of our foot or the foundation of our foot. And so what ends up happening is the area underneath the heel where the ligament lives becomes really inflamed. And patients, kind of what I hear in my office is, Doc, I get up in the morning. The first step in the morning is the most crucial or the worst pain I've ever had. It feels like pins and needles and something stretching and pulling. Then I get through my day, maybe feels a little bit better, but then by the end of the day, my heel's killing me. What do I do? The traditional approach for all this is usually a cortisone injection. And for those that don't know what cortisone is, I'm sure people do. It's very, very common. It's kind of the go-to. Cortisone is kind of like putting duct tape on the problem, right? It's not solving anything. It's not fixing the problem. All it is let's hit it with some cortisone. We'll turn the pain off. It's almost like shutting the pain signals between your brain and the actual problem. So the patient thinks they're better now, right? They leave the office. Wow, I feel great. I'm going to go back to all my activities now. What the patient's not realizing is that nothing was done to fix the problem. So sure, the pain feels great. You're feeling good. You feel like your best. But in a few weeks, when that cortisone wears off, guess what? The pain's even worse. And it comes with vengeance, unfortunately. And so the patient is confused, and the doctor, unfortunately, and I was victim to this as well with my patients. I didn't know any better. Yeah, come on in, we'll do another one. We'll do another one. And guess what? Now the patient's doing, 3, 4, 5, 6 a year, and it's really harmful for the patient. And they're just in this hamster wheel, just spinning back and forth. And the patient's just not getting any better. It's unfortunate. So this therapy, laser therapy, when we put it over the patient's heel, and we do a lot more for heel pain. This is just one thing that we add. But this laser truly, most patients first time they use laser are going to feel the effects right off the bat. I know this because I
Yeah.
use it on myself all the time. But what we're doing is we're really flushing out that inflammation, bringing good blood to the area, really healing the ligament. And really, it's a beautiful thing when these patients can heal and they feel the effects and long-lasting effects versus just hitting it with cortisone, putting the Band-Aid on. It's really magical. We use it for not just heel pain, but our nerve pain patients, post-surgical patients. I use it on a lot of my post-surgical patients because, again, surgery creates inflammation. We are creating inflammation in the body. The body doesn't realize that, but I'm creating a fracture in the patient to fix the problem. And so it creates inflammation and swelling and so forth. Put the laser on, within 1 or 2 visits, that swelling is completely gone. Patient's feeling like $1 million afterwards. So again, I'm very passionate about this, as you can tell. I love laser therapy. It works so well. I'll take it even a step further and say, a lot of people think, it's voodoo, right? And I'll tell you this, my dad's a veterinarian, and he started laser therapy in his office 10 years ago, 10, 15 years ago. Dogs, cats, they don't understand. There's no such thing as placebo effect with dogs and cats, right? When you can see these dogs almost looking like puppies again, it's magical, okay? So this laser that we use, it was used for veterinary medicine for the first 6, 7 years. And we were seeing such amazing results with, dogs after ACL reconstruction, arthritic spines. There's certain breeds of animals that unfortunately deteriorate really, really fast, right? It was incredible to see these animals just jumping around like little puppies. I mean, it was amazing. And so we're like, why not use this on humans now? And when they brought this technology to humans, it was incredible. So again, it's not placebo. Animals are getting better by this. Animals don't know what placebo means. It's working really, really well.
Yeah, that's awesome. So, obviously, you've done it for plantar fasciitis, and typically, what has happened with most people and why they're still in pain is because they're doing cortisone and these things, and they're just kind of doing that Band-Aid. And I always think of it like, your pain is saying like, hey, there's a problem here. That's why we have pain, right? Saying stop doing that. And then in our foot of all things is the foundation. It carries
Mhm.
all of our weight,
Yep.
right? And to just block that pain while there's still a problem there, and all of our weight, every step, every single day is creating that. And that's probably why it comes back with a vengeance, like you were talking about, is because it's actually making it worse. So this laser sounds amazing. I think that's super exciting in the treatment of these things. Now, how have you brought in regenerative medicine into your practice? What are some of the things that you're using that for?
We also use something known as cellular therapy. And what this really is, we kind of along the same realm as stem cells. And so what we do is we get these cells from live healthy babies' umbilical cords. And again, not to get too sciencey, but the umbilical cord of our babies have a plethora of really amazing biology, if you will. And so we have the capability and the technology now to take what's in the umbilical cords, again, from live healthy babies, of course, and now use them in our patients for so many different things. Again, we're using it from all over the body, but really specifically in the foot and ankle. Again, we'll use this for heel pain again. So we'll use the laser plus use this. They work very well synergistically together to again, to help really heal the patient from within, really help them get out of that pain. I will then pair it sometimes with surgery as well. So I fix the bunion. The bones are healing. We'll pair the laser plus the injection for our surgical patients. Does really, really well for neuropathy patients, those patients that have been suffering, who are on, medications like Lyrica, Neurontin. We're able to now use laser plus the cellular therapy to really, again, bring down that inflammation, really allow these patients to alleviate them of their tingling, burning sensations. Again, we'll use it for arthritis. There's some really promising results, with arthritis now too. Again, instead of just injecting with cortisone, not doing anything, we can use laser plus these really great cells to really alleviate the pain that the patients are feeling. So again, there's so much that we can do with them. We're doing a lot with them right now. I've used them on myself. They were great. Unfortunately suffer from knee pain, shoulder pain. I was victim to steroids and stuff, like everyone else, until I got, a little bit smarter, started to do the research, and then, come to find out that this stuff is right at our fingertips. So I use it on myself. I use it on my family. The stuff works great.
Yeah, that's awesome. So I know this treatment is, most people can do these treatments. It's not for everybody, so to speak. What do you do to figure out like what you're going to use with a patient? How does someone find out, you know, can I use this regen med? Can I use this laser? Like, what does that look like?
Yeah, it's a great question. It's all going to start with coming in to see us first and foremost, and I will say, not everybody's going to be a candidate for something like this. It's going to come down to a few things. First and foremost, come into our office. We're going to do a really great examination, really see what's going on. And again, see if are you a candidate. I mentioned, not everybody's a candidate. There are some people, where it's so chronic that, maybe we're past that stage now. And then, on the flip side, we want committed patients, right? We're not the office where, come on in and we're just going to give you the same medication you had from the last 10 doctors. This takes time. It's not an overnight success. So we want really, really committed patients who are, really wanting to take their health to the next level, essentially. If the patient's, who's maybe watching this right now and they're like, I have heel pain, but I think it's going to get better with, the Motrin I'm taking and this, I'll just keep going back to get the steroid from the doctor. And, when it doesn't work, I'll probably just get that surgery he talked about. We may not be the best practice for you. So what we're really looking for is someone who's committed, who is looking for long-term success, not just a band-aid approach. But again, we need to do screening first and make sure that they truly are the candidate for us.
Gotcha. Yeah, that's great. Well, I've obviously done regenerative medicine for a long time. It's kind of been my passion for the last 8 years or so. One of the big questions we always have is it covered by insurance? And,
Yeah.
how do I pay for this and that kind of a thing? What do you guys do as far as like helping patients be able to pay for it? Because obviously we know it's not covered by insurance. It's one of those things that when I look at what's covered by insurance, it's really the stuff that's covered by insurance covers up problems, is
Oh
how
yeah.
I think of it. So it's
Yeah.
like the medication, those types of things that are the band-aids, like the cortisone that we're talking about. What do you guys do to kind of help people do this financially, and what does that look like?
Yeah. So again, a lot of our patients are on fixed incomes. We get that. Not everybody's walking around with, all this money to spend. So what I tell patients is, look, if you want to get better, we're gonna make sure you get better. We're not gonna let money be the objection here. We have some really great financing options within the office, something known as Care Credit, Repeat MD. We have options for patients. So I never like to hear that money is the issue, because if that's truly the issue, we have a solution for that. Now, coming back to health insurance, man, we could probably have a whole podcast on just health insurance. Right now, unfortunately, in our country, health insurance is in shambles, unfortunately. And you're absolutely right. What health insurance will pay for is the stuff like the Band-Aids, unfortunately. They'll cover the The medication, that's the duct tape. They'll cover the walker. They'll cover the maybe the scooter. Actually, nowadays those things aren't even being covered. Unfortunately, I'm seeing that too. And surgery, they'll cover the surgery. Maybe they'll cover the surgery, right? So let's use the neuropathy for example. When that numbness gets so bad, where that patient has wounds on their foot now, it's too late. Oh, well, yeah, sure, we'll cover the amputation. But Mrs. Jones, we're not going to cover all that other stuff your doc talked about, that this, the good stuff that can help you. We're not going to cover that. Yeah, insurance is meant for really just helping the really trying to mask the symptoms, unfortunately. They're never going to cover the stuff that can prevent illness. They're never going to cover the regenerative stuff that can truly fix this. Again, this is maybe a little political, and may not want to go down this rabbit hole, but it's, health insurance is a business at the end of the day. They need to keep their pockets full. How do you do that? Well, why does it make sense from a business perspective to get that patient feeling great so that they no longer need to pay for that health insurance? I don't know. Again, like I said, we can have a conversation about that later down the road. But yeah, it's not covered by insurance, but we have again fantastic financing options for our patients. I don't want that to be the main factor as to why this patient can't get treatment. I want to help as many patients as possible.
Yeah, definitely. There's so many options out there now. Just in doing Regen Med, it's rare that we find someone that can't, get a financing plan or something like that to get the treatment.
Absolutely.
So you mentioned Shockwave. So we've talked about the laser and what
Mhm.
it does, the Regen Med. How are you guys using shock? What is Shockwave, and
Yeah.
how do you use that in your practice?
Yeah, yeah. So shockwave kind of sounds scary, shock, right? So shockwave therapy, also in the same realm as regen med. I call it like the cousin of laser therapy, if you will. And let's look at this for example. A lot of people know what kidney stones are, and so if you have kidney stones, your kidney doctor is going to go and use a method where they use really high frequency sound waves to break up the kidney stones. Very commonly done. The technology is similar in shockwave therapy. So what we're going to do is we'll pair it with the laser and we'll use heel pain again. So again, I mentioned laser will bring good blood to the area. It'll flush the inflammation. Well, what our body's doing internally at the same time when we have inflammation, like again, a torn ligament, inflammation is we're building like an internal scab inside. That's what the body knows. And so that internal scab kind of traps inflammation. So what we do with the shockwave is we place it over the area and we send high frequency sound waves to that area. And what it does is it breaks up all that scar tissue. It also brings good blood to the area. It brings the body's natural stem cells to the area. And for anyone that doesn't know what a stem cell is, really what this is, it's a cell that has no identity just yet, right? And so it'll come to the area and it's like a contractor saying, hey, plumber, I need you to go there. Hey, drywall guy, I need you to go there. Hey, electrician, I need you to go there, right? So imagine this contractor sending these cells out and saying, hey, I need you to go there and fix this. I need you to go and patch that up. That's essentially what our body stem cells are doing. So shockwave is allowing those stem cells to come. It's going to break up all the scar tissue. Stem cells are going to get in and literally start repairing the ligament versus just putting duct tape over the problem.
Yeah, I love it. And that's, one of the things that a lot of people don't realize is, why does it take us so long to heal as we get older? And why is it that, I used to be able to go play a full football game and feel fine the next day, and
Mhm.
now I
Yep.
get out of bed wrong and I'm hurt for three
Yep.
weeks, right?
Yep.
Like,
Yep.
so, and a lot of people don't realize our stem cell count goes down
Yep.
tremendously as we age, and
Yes.
being able to reintroduce that with umbilical cord tissue
Hmm.
and have that there, that's when we actually start to see that healing process take place. So people with neuropathy that haven't seen results, like this can be a game changer.
Oh yeah.
Plantar fasciitis, like you're talking
Hmm.
about.
Hmm.
What are some of the other things? Are there any others that are kind of biggies in your office that
Yeah,
you've
yeah.
seen some good
So
difference?
arthritis, right? It's huge in the foot and ankle. So a lot of patients in my office come in with what we call hallux limitus or hallux rigidus. This is where there's arthritis in the big toe joint, very, very common. And so again, what most patients are gonna do is they're gonna go to their doc, and their doc's gonna talk to them about two things. Let's hit it with steroid, and when it's really, really bad, let's just take the two bones and weld them together so you can't move it anymore.
Mhm.
Joints are meant to move.
Yeah.
We were meant to move. Joints are meant to stay supple. So that again, and again, the insurance will cover that aspect. Let's just weld the two bones and let's just say, hey, no more movement. Ankle arthritis is huge as well. We've been able to help a lot of people. I'll tell you a story actually. I had a gentleman um, from Michigan originally, now is down in Florida. He's a big golfer. His big thing was, look, Doc, I love to walk and I want to walk 18. Okay, let's see what we can. But I have end stage arthritis. My docs are offering me fusions or ankle replacement surgery. I don't have time for that, nor and that sounds scary. I go, look. You're pretty end stage. I don't can't promise anything. We can try a round of some laser and some of the cellular therapy, and we'll see how you do. Well, we did a few rounds for him, and then I followed up with him 6 to 8 months later, and honestly, he was like, Doc, this is the best I've ever felt. It's still there. There's some pain still there, but I'm now able to walk 18 and not have to take all those long breaks anymore. One of the happiest patients ever. And honestly, in my mind, I was like, I don't know how well this is going to be because he waited so long for this, and that's where the screening comes in, right? And I told him, I go, look, we're going to do our best for you. If you'd come in a few years earlier, maybe better results. I don't know. Let's do our best. He did great. He honestly did awesome. So ankle arthritis, um, arthritis of the big toe joint, arthritis in the midfoot, that middle aspect of the foot. We see a lot of that, and this works great. Again, we get a lot of flat-footed patients here, and a lot of our patients with flat feet are going to get pain on the inside of the ankle. There's a specific tendon that holds the ankle or holds the arches up. That tendon, when the foot becomes flat, starts to get micro tearing, becomes really inflamed. And again, what's the answer to all of this? Let's go do a big flat foot reconstructive surgery. Mind you, that's a 2 year recovery. I used to do that surgery all the time. Now we have all this great technology at our hands where we don't need that surgery anymore. We can really rebuild this tendon without that surgery. And mind you, we can always go to surgery if these things don't help, but they usually help a lot of our patients. Soft tissue problems, arthritis. Again, we talked about the heel pain, nerve pain. We can help all our patients with these things.
Yeah, I love it. It's great to be able to go to someone who can do a surgery if you need it, but they actually have all these other things they want to do before surgery, right? It's like when you go to a back surgeon, it's literally just surgery or nothing, right? And
Oh
so
yeah.
this kind of going to you, you can figure out like, all right, is there a less invasive way that I can do this?
Oh
And,
yeah.
maybe never do the surgery or do the surgery 5, 10 years down the road.
That's exactly right. That's exactly
Yeah.
right.
Yeah, that's awesome, man. Well, this is super exciting. I just wanted to get on and kind of ask you about it. Just I've done so much in Regen, and I love hearing how you're using it in podiatry for all
Hmm.
these different concerns and all these issues. And I think that, this just needs to be spread around more for more people to learn about this and understand that these options are there because so many people are just hopeless, right? They feel like they've tried everything, or maybe what about someone who's done surgery or even had maybe like a reconstruction, can they still get relief even if they did that and it didn't work?
100%. 100%. And that's again another reason why we pair a lot of this with our own surgical patients. But I have seen many other patients that have come to me from previous, surgery 10, 15 years ago. They're having, we call it neuritis, again, nerve pain, or maybe the bones didn't heal appropriately, or they've just been caught in that inflammatory cascade that we talked about from surgery. And they've tried again everything, right? From what they think they've tried, but then they come see us and it's almost like a completely new world for them when they see what we can offer them. And yes, we've helped so many of these patients post-surgically with again cellular therapy, laser therapy, and so forth. And so yeah, absolutely. Come see us. Let's have a conversation about it. See, if you're a candidate. I really believe we can help a lot of our post-surgical patients with this.
I love it. I love it. Well, thank you, Dr. Wadera, for coming
Thank
on
you.
today.
Thank you.
If you're out there and you're having, foot pain, neuropathy, plantar fasciitis, these things we talked about, contact Dr. Wadera's office. A lot of amazing things he's doing there. I'll get your number on here in the post edit here so that people can call your office and tell us where you're located.
Yeah, so we are in Southeast Detroit. We are in a city known as Birmingham, Michigan, just about 30 minutes outside Detroit. Very beautiful city. Come meet us out here. Would love to have a conversation and help you guys out.
Great. Thank you so much, Dr. Wadera.
Thank
Have a
you.
great day.
You too, sir.